Hi, I'm Adrian Hernandez, a cardiologist at Duke University. I'm pleased to chat with you about what we're doing at the QCOR conference. So we just had a great session, it's a plenary session regarding how entrepreneurship will transform healthcare quality and outcomes. And here what we're really interested in is actually understanding what it's going to take our ideas and actually implement them in practice. So we have this humongous opportunity in terms of unmet need regarding healthcare quality. The time is ripe right now. Our room and our community is filled with great ideas and great people, but we actually need to change that from ideas into practice. And along the way, there's some interesting ideas in terms of how entrepreneurship or innovation will actually lead the way. And so in our session that we had, we actually did a panel discussion regarding what it really takes to develop an idea, make sure that it is addressing an unmet need, make sure it's scalable, and that actually it can be disruptive, so change a practice that hasn't been changed in the past. And so for our panel, we had actually a PhD health economist who's a researcher at the Fuqua Business School, Ronnie Chatterjee, who actually does research on entrepreneurship and what are the types of entrepreneurs that are successful, what's the process for success, and what's the innovation pathway towards that success. We also had perspectives from a cardiologist and also an entrepreneur. So Uday Kumar is an electrophysiologist based at Stanford and has been integral in the Stanford Biodesign to actually take it from a perspective of looking at what's an unmet need and breaking down the problems and seeing what solutions can be developed to address those problems. And he's also a founder of a couple of companies where he's done exactly that and has not limited any barriers in terms of taking an idea to a solution. And so he provided the example of what can be done as a founder as well as a practicing cardiologist. And then finally, we had Nathan Every, who's actually a founding member of the QCOR community. So he's a cardiologist and actually led a number of early outcome studies in terms of importance of care and outcomes in myocardial infarction, and is now a venture capitalist in the Fraser Healthcare. And so he gave us a perspective of what it takes or what they look at as a funder of good ideas, and also what it takes to start up a company, what are the type of people are needed, and then how to form that idea into a startup and actually translate that into something that can be actually used in healthcare. And so his perspective was very interesting, similar to what you would expect to see from grant review committees regarding what they're looking at in terms of what's going to be the best science, what's going to be the best idea, how will actually impact practice. And that was really important for him in addressing an unmet need. One other thing that was quite interesting about our session and completely different from others is that we actually made this in a fashion that hadn't been done before. So in the spirit of entrepreneurship and innovation, we actually told our speakers that we're actually not interested in slides or didactics. We actually want a true discussion among the panelists on what it takes to take an idea, develop it, and change practice. So in all, it was an incredibly successful program. Hopefully everyone was energized by this to actually now take their good ideas and seeing what they can do and take it to the next level, and also figure out what their role is in terms of the innovation process and actually closing the gaps that we have currently in healthcare. Thank you.